Good morning, everybody. Dr. Kramer, Hope Upper Cervical Spine Center. Welcome to another awesome episode of the Upper Cervical Corner. Today, I want to talk to you about a statement that I heard on a podcast that was incredibly revealing on the nature of humanity. And the statement goes something along these lines. How do I know unless I look? You see, the field of health in general is a very convoluted place for many of us, right? Many of us are simply trying to eradicate a symptom of behavior that we have accumulated over time that has generated a less than desirable quality and quantity of the expression of health. And then others of us are victims of traumas that have happened that aren't necessarily within our control, right? Car wrecks, abuses, physical injuries, things along those lines. But for the most part, we have a common thread that happens in the health sphere that needs to be addressed. And that is the idea of how do I know unless I look? So often, too many of us think that we need to go to the doctor and demand a prescription. Or I have some anxiety, so I need a pill. Or I have some depression, so obviously I need some serotonin. Or I have ADHD, so now I need some Ritalin. Or I have X disease, I need this pill. And my answer to you is, how do you know you have that unless you look, right? They have amazing imaging systems that can show you brain pathways that actually may or may not be exactly what you may be symptomatically feeling. This is the premise of root cause approaches, right? The body is an organic system as a unit. You cannot affect one part without affecting all of the others. It's highly tuned, right? It is organized to allow you to have optimal adaptation. And the only way this is done is through coordinated effort of your nervous system, right? So then begs the question of, how do I know my nervous system is performing? And this is where chiropractic and health marry together in such amazing, amazing ways, especially when it comes to upper cervical care, because it just makes sense. How do I know unless I look? So many of us go into a chiropractic office, we go into an MD office, you go to a DO office, and it's fascinating to me because if you go to the MD, they're going to draw blood, they're going to order imaging, right? And you have no problem with that. If you go to the DO, they might do an ultrasound, they might order an MRI, they might order an X-ray just to evaluate what's going on. And then you're going to go back and have a follow-up discussion about what's happening with the specific issue. However, if you go to a chiropractor, you're going to lay down at a table, let the guy feel your neck and just crunch it. Or he's just going to look at your back with his hands and he's going to crunch it. Or he's going to lay you on your side, he's going to crunch it. He's going to go, you feel better? And then he's going to take your money from you and you're going to be like, what did I just pay for? Right? This is where the side of upper cervical care is incredibly beneficial and far outweighs any type of intervention, because how do I know unless I look illustrates exactly how we take care of a patient. Our job is to get to the root cause of the systemic problem that you are suffering from. The only way we can do that is by, one, analyzing your nervous system, and two, looking at the biomechanics of the skeletal structure of the upper cervical spine to know where the abnormality is taking place and make the best clinical decision to restore normal, as evidenced by evaluation number one, the nervous system scan. So with that being said, how do I know unless I look is documented and captured in the assessment of your nervous system utilizing paraspinal skin thermography. This is a very valid measurement. It's been around for a very long time. 1923 is when we started doing it in chiropractic, and it has only accumulated data, results, and evidence to further support the clinical decision-making that happens inside of an upper cervical office. So if you are going to a chiropractor and you are not receiving a thermographic evaluation, then you are in the wrong place. Because how do you know unless you look? And if your paraspinal thermography is abnormal, and then an adjustment is given, then the paraspinal thermography should be restored to normal. How do I know unless I look? Then the second piece of this is the x-ray. So many of you are getting hung up on this idea of radiation. It's absolutely mind-blowing to me because it is clinically detrimental to the patient to get the wrong adjustment, to get it incorrect, and to guess when it comes to what is going on in the neurological presentation of your spine. The bony mechanism of the spine protects your nervous system. And if you just thrust at it willy-nilly because something feels stuck, we're going to create a whole lot of problems. Thus, the need for the imaging, whether it be a cone beam CT or biomechanical motion x-rays, will give you the opportunity to see where the biomechanics are wrong and how we restore normal. How do I know unless I look? Every single piece of a clinical decision inside of an upper cervical office is designed to expose to the patient that there is an underlying root cause problem that can be resolved and restored and sustained. Accumulated evidence of a clear paraspinal graph supports the conclusion that the restoration of health is evident. And this happens constantly inside of every single upper cervical office. Our job is to take you, the patient, ask you the questions that lead you down the path of asking, how do you know unless you look? And then we show you that either A, there is a problem with your nervous system, which means you are definitely in the right place, or B, there is not a problem with your nervous system, which means some other outside stressor is causing the presentation, right? Whether it be a tumor, a stroke, a cyst, or something that is outside of our realm of practice. That is the beauty of what we have to offer. And our consultation process, which is always complimentary at Hope Upper Cervical, we aim to help you, the patient, find out and discover if upper cervical care is right for you. Because we aim to answer the question, how do we know unless we look? If it all lines up and makes sense, the biomechanical x-rays simply show you how we fix that problem, and then we work together to create the stable presentation of a neurological system that is able to sustain stress, to harness adaptation, and to accumulate optimal expression of health so that you, the patient, can go thrive in your life and do what God has created you to do. That, my friends, is the beauty of that question. How do I know unless I look? Is designed to help you understand that to simply lay down on a table and allow somebody to feel your neck and crunch you is a giant disservice. It is no different than going to the MD and demanding that you be put on a drug without blood work, without imaging, without any form of analysis whatsoever. When you take away the analysis, you, my friend, are subjecting yourself to becoming a clinical lab rat. Why wouldn't you decide to pursue the noble art of how do I know unless I look, instead of just guessing at random? That, my friends, is the lesson today. How do I know unless I look should be a guiding factor for any clinical intervention you choose as it relates to your health. Dr. Kramer, Hope Upper Cervical Spine Center, you all have a blessed day.